Our Regent Peak team is honored to have the opportunity to meet some really interesting individuals who we feel have a unique life story to tell. It's one of the reasons we decided to create this series, Peak Performers. We want to share their stories because we found their creativity, drive, and dedication are motivating. We know everyone is busy, and we wanted to keep these interviews moving, so there are only 5 questions. We hope these interviews you hear today will inspire you to become a peak performer. So let's go. Hello again, Craig Robson, founding principal and managing director of Regent Peak Wealth Advisors. Today I have the good fortune of introducing Dr. Brian Hill, who's not only a board-certified urologist, but also the CEO and founder of a firm called HIPnation. HIPnation was created to intentionally change and disrupt the primary care physician and patient experience. Look, by minimizing the role of the insurance companies within the equation, HIPnation is providing better price and cost transparency and access between that primary care physician and their patients. And who wouldn't want that? I had the good fortune of being introduced to Dr. Brian Hill by my orthopedic surgeon. And once I heard the story, I was fascinated by the HIPnation model, so much so that I became a member. And I could share with you my relationship with my primary care physician today is better than I've ever had in my lifetime. So with that, Brian, thanks for joining us.
Oh, thank you. And you know I love hearing that.
I'm sure you do. There are much worse things to hear.
Yes.
You know, I go back to the first meeting that we had where my orthopedic surgeon introduced us, and I think about the story and the parallels between, your journey of HIPnation and Regent Peak's journey, in that we both saw that there was something wrong within our respective industries, and we decided that we're going to try to fix it to deliver better outcomes. Would you agree with that?
No, I agree 100%. And I think that was one of the pieces that really attracted me to you when we were having that initial conversation, is just that love and passion for what you do, financial planning, what I love, medicine, and the fact that we were willing to kind of take a look at those industries and say, how can we actually do this better for the person that matters, right? The person that we take care of. And so it was really a joy sitting down and having a conversation with you.
Yeah, you bet. So heading into today, I have to admit, I was thinking maybe I should change the name of this from Peak Performers to Peak Disruptors, but I think my marketing team would not like that.
Although I like that.
So my first question, let's just look backwards. So Brian, it doesn't have to be your first role, but maybe one of your early roles. Which one of those roles shaped you in terms of what you're doing today, and how so?
It's kind of funny. You look back in life, we've carried a lot of different roles in this world, and I think if I look back and try to go, where in my life did I start learning and shaping who I am as a person, I'll go really maybe kind of boring. I remember when I was a little kid and we were building a new house in Virginia. My family moved to Virginia. I grew up in a large family, loved to delve into that a little bit. And in the house, when we were going through building the house, didn't have a whole lot of capital, my father would pay us, as the kids, to go around and fix little nail pops that had popped around, so we didn't have to pay for people to come back out and do that. During that time and kind of getting that insight into doing things diligently, doing things to your best you possibly can, and be willing to do anything, right? We did this, for our family. It's that willingness to kind of step in and go, you need to do what needs to be done. And I think one of those traits that we kind of carry forward, especially if we're trying to do something big in this world, is you've got to be willing to do what it takes to get things done. And I learned that at a very young age from something very simple, like my father setting us up as kids to fix little nail pops while we were putting our house together.
That's an excellent answer. So foundationally, that set you up for really all your work habits, your ethics today in the role that you currently serve.
No, it really did. And it's those little things, and I think it's kind of funny, you have children, I've got children, I look back at that personal experience and go, how do I take some of that things that I've learned? It's not the first job, it's not necessarily these grandiose mentors in our life. It's those small little steps along the way that kind of really carve who you are as an individual.
So let's talk about mentors, right? So we all can look back in our lives, and whether it's from a personal or professional level, or maybe a combination of both, share with us 1 or 2 individuals that really have left a lasting impression on you, and how so?
Yeah, so I'll stick with my theme here, I think, a little bit. I'll stay boring and maybe kind of a little cliche. I'll go back to my parents. I really will. So it's interesting, I was on the phone actually with my parents last night. So my mother, social worker at heart, actually was a social worker, and she was a dreamer. She was one of these people that as a social worker, she wanted to figure out how she could change the world. And so when we were young, we first actually started having foster children in my family, just when my mom had to stop working as a social worker. transitioned that into adopting a lot of my brothers and sisters. So I'm now one of 15 children, and we've got huge
15.
family. One of 15, huge family. 11 of which we've adopted. So one, just that that idea of my mother going, how can I step into the world and make a difference, and maybe be a disruptor a little bit, if you will, in her sphere of influence, and what she was able to do. One, like I said, just a key influence in how I go out and view the world. The second, again, being cliche, was my father. My father was a person in the background with a mom who's a dreamer, but my father was somebody who just got things done. He was we jokingly say he was the mule of the family. He was always working, doing what needed to be done, filling the roles. And so it was really kind of that combination of my parents looking at the dreamer and how valuable that is, but realizing that you need somebody executing on the side to really run a family of 15 well. And I just have to kind of look back at them and go, they're just kind of that foundational piece of my life.
I love that answer. And look, parents are so foundational from a family perspective. And so I commend you for coming up with that one. That's a good one. Let's kind of still in this theme of looking backwards a little. So, I love tinkering with things. I'm a big kind of test things out before we go big, right? Small sample size before we implement things. Yet if I had the ability to look backwards and kind of go back on the journey and say, what were one or two things that I wish I would have done differently if I had that knowledge capital today? So from your perspective, looking backwards, share with us maybe one or two things you wish in hindsight you could have done differently.
Yeah, I think history is always interesting to look back on. One, I think we always kind of look back and go, I wish I could have done this differently. Maybe I should have done that differently. Obviously, right, all of those things carve us. Every decision that we've made along the way in life has added a bit of this flavor to who we are as people today. And if you go, well, if I change that, am I really going to be the same person I am sitting here today? But that being said, if I look back, and part of this is what we're trying to do in the world of healthcare, of being a disruptor in the world of healthcare, part of this is the love of medicine. I'm a surgical specialist. When I first actually went into medical school, I thought I was going to be a primary care doctor. That was I thought my calling in life was to just be that follow people through their life and be that inner, kind of person that partners with them through their life. The deviation that I took to move into the surgical specialty space, honestly, was just an outpouching of a healthcare system that wasn't functioning very well, and kind of a lot of the misery that I saw in the primary care space. And so that kind of made me deviate into a surgical specialty world. Now looking back, man, I wish I was a primary care. I wish that I had that understanding of that space in healthcare better than I do right now. And so maybe that's just a little deviation that I took along the way that I kind of wish I'd stayed maybe on the track of a primary care physician as opposed to a surgical specialist.
All right, so let's look forward. So talk to us about maybe something that's really innovative you're working on, or something that you're really exciting that you're getting ready to introduce in either role as a urologist and or in the HIPnation model.
I got to stick with my HIPnation theme here. Being in that space of disruption, one of the fun pieces that we have in what we're doing. You kind of said we're not working at the behest of the insurance company. We work at the behest of our members. By doing that really changes our focus. You become my customer as opposed to the person who normally pays in the insurance-based world, which is the insurance company. So that allows us to change our focus to how can we better meet your needs, and how do we meet the needs of a new healthcare ecosystem that we're putting together. One of the pieces that we're putting together that excites me is a technology platform. Everything that's in healthcare right now is based around coding and billing. How do I code an office visit to an insurance company, bill that out properly so that I get reimbursed from them later? That goes away in our model, and so now we can actually create technology tools that go, how can I be a better doctor to you? How can I manage and treat you better? How can I provide better access to you? And we live in a world of price transparency as well. How can we help you be a better consumer in the world of healthcare by identifying lower price procedures and imaging centers and things of that sort, while maintaining the level of quality that we expect out of the healthcare system? And so we have technology tools that we're putting together that are really kind of creating the foundation for our vision of what this healthcare ecosystem should really look like, and it's just a fun place to be.
Okay, so we're getting here kind of near the finish line, right? So my final question for you is, if you couldn't perform in the role you are today, for whatever reason, what else could you either see yourself doing, or would you like to be doing?
Yeah, that's a great question. Maybe a scary one when I start thinking about it a little bit. And some of this is kind of the tracks you think about in life. I think if I weren't doing this, my other calling in life, my other debate in life was interestingly, a math teacher. I just love the idea of teaching, love the idea of influencing kids, and being able to be a nerdy math teacher in high school was probably the other track that I was really strongly kind of considering in life. So that might be one track that I was down. The other piece that I would probably consider or have been looking at, and this is the one that's maybe a little bit scary in today's world, is politics. Right, the world needs leadership, and it needs change, that's doing what you're doing in the world of finance. How do I create a better mousetrap to provide a better product to people? How can I in healthcare create a better mousetrap to provide better care to people? It's the people, right, that we're supposed to be focusing on, and I think we need that in this world of politics. And so that was my other debate in life, is going, how do you create big footprints? And that might be another opportunity, as scary as that is to say.
Well, back to your first response. So look, my clients and my team always hear this phrase. I'm an engineer. I call myself an engine nerd. So the nerds rule, right? So there's nothing wrong with being a math geek. I love it. So as we close out another Peak Performers, my commitment to each of you is to continue to identify unique individuals with really interesting stories from varying backgrounds. So Brian, I just want to thank you for your time today. You certainly checked that box, and I want to thank you for being a Peak Performer.
Well, thank you, Craig, and I appreciate the time to be with you.
You bet. Thank you again for listening to this latest episode of Peak Performers. Our wish for each of you, in your own personal way, is that this conversation inspires you to keep climbing.